Established risk factors include nulliparity, multiple gestation, molar pregnancy, pre-existing hypertension, which we talked about in the other lecture, those also who have renal disease as a complication of their pre-existing hypertension are at very high risk, previous severe preeclampsia, eclampsia, non-immune hydrops fatalis, and a family history of preeclampsia, eclampsia. Also thrombophilia, whether it's inherited or acquired, connective tissue disease, and long-standing diabetes are all risk factors. So what about nutritional factors? The incidence of preeclampsia doubles in women whose daily intake of ascorbic acid was less than 85 milligrams. Obesity is a huge risk factor for preeclampsia. Genetic factors, tendency for preeclampsia and eclampsia is inherited. In fact, in a Swedish study, there's a 60% concordance in monozygotic female twin pairs. 1.2 million births have reported a genetic component. So getting back to the vasospasm, you have vascular constriction, which causes resistance and subsequent hypertension, endothelial cell damage, which we saw in that cartoon, which causes interstitial leakage. Platelets and fibrinogen are deposited subendothelially. And the consequences is you have ischemia of the tissues, which lead to necrosis, hemorrhage, and end organ disturbances. Endothelial cell activation factors are likely from the placenta and are secreted into the maternal circulation. They provoke activation and dysfunction of the vascular endothelium, and the preeclamptic syndrome is thought to result from these widespread endothelial cell changes. They secrete substances that promote coagulation. It increases their sensitivity to vasopressors, and the glomerular capillary endothelial changes cause an increase in the permeability of the capillaries within the glomerulus of the kidneys. So you can see that in this picture here. This is a light micrograph in preeclampsia showing glomerular endotheliosis. The primary changes are swelling of the damaged endothelial cells leading to partial closure of many of the capillary lumens, which you can see with the large arrows in that picture on the upper left, and mitosis within an endothelial cell, which are the smaller arrows. There's also angiogenic factors, glycosylated glycoproteins that are mitogenic for endothelial cells. There's something called, they call it VEGF. It stands for vascular endothelial growth factor. It increases in preeclamptics, but its bioavailability is decreased. There's also a placental growth factor, otherwise known as PIGF, and it's secreted largely in normal pregnancy. It promotes angiogenesis and induces nitric oxide and vasodilator prostaglandins. There's also something called SFLT1. This is all from laboratory research, but it's important to understand the pathophysiology. That's soluble FMS-like tyrosine kinase 1, and it antagonizes both VEGF and PIGF. But in preeclamptics, the gene for this protein is upregulated. So you have a decrease in VEGF and PIGF, and therefore you have more preeclampsia. You can look at this pathway on your own, but it's really just summarizing the pathophysiology that I've tried to explain in these last few slides. And this is another schematic that you can review on your own, but it's basically summarizing what I've just said. You have poor placentation, then you have a stressed placenta, which then increases the release of SFLT1, leading to dysfunctional maternal endothelium, ultimately leading to clinical signs of preeclampsia. Going down the other path, you have the syncytiotrophoblast debris and other factors which lead to maternal systemic inflammatory response, which leads to clinical signs of preeclampsia. And this picture shows the different components of the disease, again summarizing what I've said in the previous slides. And that concludes our talk on preeclampsia, eclampsia, which is a very complicated disease when we think about it from the scientific point of view. But clinically, we need to know how to diagnose it and how to manage it, because it's a huge cause of maternal morbidity and mortality all over the world. Thank you very much.